After we had said the diagnosis, we also talked about the therapy. And I actually remember that same visit when I told you that you did fulfill the criteria for multiple myeloma. I gave you some high points on that we need to start therapy, and I talked to you about the different steps in the treatment. Had you looked anything up before you came to me on the treatment?
No, I did not.
So you heard about the diagnosis, you heard about the treatment. I assume that that was quite overwhelming information at that same visit.
Yes, it was.
So when you came home, how did you process that?
It was very difficult for me to process it all. In one day, I went home and I just thought about everything that was said to me, and a lot of it was confusing because, you know, there were a lot of terms that I didn't understand in the beginning. But once I started reading about them, they became a little clearer to me.
So what I told you was that the standard of care at the current time in the United States would be to offer a 3-drug combination. And I said to you that the standard of care in the United States would be to use a proteasome inhibitor with an immunomodulatory drug and a low dose of steroid. So it could either be bortezomib with lenalidomide and dexamethasone, or it could be carfilzomib with lenalidomide and dexamethasone. Those would be the 2 key options that we would use in the United States at the current time. And in your case, we started you on bortezomib and lenalidomide and dexamethasone. That's the most common combination that is currently used. Did you read up on those drugs when you came home, and I've told you about those?
I did a little research on them, but again, when when you're overwhelmed with information, it's very difficult to understand some of it. So I do better when I'm experiencing things like that. So when I was under the treatment, you know, I understood a lot of the things, like, for example, side effects that you can get from these treatments. And I did experience it, a lot of them. I experienced fatigue, and I experienced a lot of pain with these treatments. And but prior to that, I didn't know, you know, what I would be expecting.
And we also talked about the necessity of moving forward from the combination therapy, and either we could do a transplantation or if we could hold off with that. And then we were talking about maybe doing maintenance or not doing that. Mm-hmm. And we will talk about those details in further detail in a little bit. But we had this conversation at the first time we talked about treatment.
Mm-hmm. Yes.
So we basically outlined a long period of time of therapy there.
Yes.
So did you know at that time that the therapy had to be long, or that was new information to you?
That was new information to me. When you started talking about the stem cell transplant, I did a lot of research on that. And in the beginning, I was adamant that I did not want it.
Right.
In the beginning. But as time went on, I was a little bit more open to it, you know, when I did research, because I did research about it, and I spoke to other people that had it, because through the LLS, they recommended people that I could talk to that had been through these procedures already. And some of them called me and explained to me how their process went. And it sort of like made me less afraid of having the procedure done. So I became more open to it, and I agreed to it. Eventually, I did agree to it.
But it was something you were not really sure about?
No, I was not sure about it in the beginning.
And no. I think we talked about the fact that some people choose not to do it and some people choose to do it. Mm-hmm. And I think we talked about the fact that if we could drive the disease all the way down to zero with just therapy, that would potentially be a way where you could hold off.
Right.
So that's something we did talk about.
Yes, and that sounded good to me, and I figured, let's go and do the stem cell transplant, because I think it would be beneficial for me to have it done.
Because the combination therapy did not bring it all the way down.
Right.
So I think you did absolutely the right thing.